Good afternoon, everyone. My name is Nicole Fernandez, and I am the project manager of the Maternal and Infant Health Series here at Wayside Recovery Center. You are attending a session today, Respect in Healthcare, Human Right and Provider Obligation with Dr. Leslie Farrington, co-founder, the Black Coalition for Safe Motherhood. Some of you may be familiar with Wayside, but I'll just share a little bit about Wayside Recovery Center. Wayside Recovery Center's mission is to break the cycle of addiction and trauma for women and children and families. We offer mental, physical, and behavioral health care for the entire family. Our wraparound services create a stable foundation for long-term health and well-being. We specialize in culturally responsive care to increase health equity in Minnesota. I also would like to share that our grant with SAMHSA and the Department of Human Services in Minnesota has extended our initial SOAR 2 grant. We'd like to thank them for their funding and support. And as a result, we are able to start our new series with Dr. Farrington today. Also, one of the additional new things that we will be doing is we are creating a resource hub on our website. We want to be able to list other Echo Hub's trainings, as well as provide local and national resources. Through this work that we have been doing, we have connected with so many amazing providers, professionals, health professionals, and practitioners. And we know that even though we try to share this information, some people miss it. And so we're hoping that even if they don't get to come, for instance, to this session today, they can still find information about the Black Coalition for Safe Motherhood on our website, find a contact, and also see some of the awesome training that they're providing. So that's what we are doing. We hope to launch our resource page by February. We are making edits to things right now, but we really are excited about this next year and a half, continuing this very important work. And then lastly, as always, we're only as good as our community network. And so I'm always looking for the bright mind, the organization that may be doing good work, but we don't know about them, or even the practitioner or student, graduate student who is doing something really courageous in community and research, and we should know about it. So please feel free to always email me or send my contact information to others. Without further ado, I'm going to read a brief bio, which does not cover all that Dr. Farrington has done in her career. But I will read a brief bio and then I will turn it over to Dr. Farrington. She will give a brief presentation, and during the presentation, we will be using the chat. We'll ask you to engage in the chat and share your responses, which I'll read out loud. And then we will have time at the end for a short Q&A. This session is recorded. Some resources will be shared with you. And as always, we always want to respect each other's intellectual property. So what is shared with you because you attended this training, we ask you to not forward it. It is for your reference. And also the recording will be online. If you feel like someone you know really should have seen this session, they will be able to click on the link on our page for past events, and there will be a YouTube link there. So without further ado, I would like to introduce you to Dr. Leslie Farrington. She is a retired African-American obstetrician and gynecologist with 15 years of experience in community-based patient safety education and almost a decade of study of the U.S. maternal health crisis and the history of racism in obstetrics. Without further ado, I'd like to introduce Dr. Leslie Farrington.
Thank you, Nicole. I'm so excited to hear about Wayside and all that you all are doing. This is exciting. I'm glad to hear that. And thank you for this opportunity to share information with you all and also to hear from you all on a topic which has been my focus for several years now since I retired from practicing OBGYN. And please call me Leslie. Everyone can call me Leslie. I'm all about removing that power differential between physicians and everybody else when it comes to health care. I was raised by let me see here, my slides are not moving. Let's see. Here we go. I was raised by my interracial parents in New York City during the Civil Rights Movement. And my upbringing shapes my passion to address the impact of disrespect and racism on health. So I dedicate my work to Dwayne and Joan Farrington. Now, my dad did not finish high school, but he understood the importance of history and of knowing history. So I will, in this presentation, briefly cover the history of racism and the history of maternity care, obstetrics, and midwifery in the United States, so we understand why we are in need of respect for humanity if we want to achieve health equity. After this talk, I hope you'll have a clear understanding of how disrespect affects medical care and health. I especially hope you will remember the many ways that consumers and providers of healthcare can improve experiences and outcomes by respecting themselves and others. My organization's mission is to improve Black maternal health through promotion of healthcare education and advocacy. We also promote holistic community support of birthing families. We use the ACT curriculum for this purpose, and I'll discuss ACT later on. For now, I'll just say that ACT is one toolkit that Black and Brown consumers of medical and maternity services may use to get safe, respectful care. Here are some definitions of respect which pertain to healthcare. From the Oxford Dictionary, due regard for the feelings, wishes, rights, or traditions of others. And then from the Kids Helpline website, this gives guidance which I wish all medical and helping professionals would live by. Treat others the way I want to be treated. Accept someone for who they are. Respect in relationships builds feelings of trust, safety, and well-being. Why is this important? Well, for people, and many of you know this, for people in the vulnerable situation of being a patient or client, respect is so important to reduce anxiety and to foster good communication. Effective communication is essential for safe care. Respect is in short supply here, and people are not valued equally despite the high ideals set forth by our founding fathers. Our society is hierarchical. From the time the settlers took control of this land to the present day, color, ethnicity, and gender have influenced the pecking order or ranking. Native peoples were deemed savages to dehumanize them and justify genocide. The enslaved, the indentured servants, and waves of immigrants were stereotyped and exploited. Our society is hierarchical so that the higher one is in the pecking order, the more power and freedom one has, the better services and education one receives, and the longer one's life expectancy. In the US, the isms, I call them the isms, they influence health, wealth, and quality of life, especially racism, but also sexism, ableism, classism, heterosexism. Add what I haven't mentioned in the chat. There's a stigma for those who are dealing with mental illness. So stereotypes and stigma are firmly embedded in our society. They are maintained in the media, in research, and in medical and helping professional education. The isms drive the social determinants of health, most of which are listed on this slide. And you can list some more determinants of health in the chat. Those in power and in politics control the masses by keeping people divided based on these isms. And we are in a state of competition for resources like crabs in a barrel. It's no secret that President Lyndon B. Johnson, about 60 years ago, said, "You can pick the pocket of a poor white man if you tell them they are better than a Negro." Now, we can all thrive if we respect each other and our shared humanity. Unfortunately, profits over people drive these determinants of health. Now, here's a question for you. I hope you'll respond in the chat. Have you experienced disrespect in a healthcare setting? How did you feel? And did you go back to that provider? Was there an ism involved? Even waiting in an office for 2 hours to see a provider, I think, is a form of disrespect. So I hope you'll share in the chat if you've experienced disrespect in a healthcare setting.
I'm waiting for those responses. We have yes from Ariel. Do you want to elaborate, Ariel, maybe? And others, please share. And ageism, Susan. Yes, and I did not go back to the provider, Tina said. Yes, my male doctor blamed my uterus for having a hard time finding my cervix. Wow. Christine, I'm sorry. Any others? Yes, racism. And I felt from Zora, I felt hopeless. Yes, from Julia, I have experienced weight-related stigma that had long-term consequences on my health. Christine said, she said, I did go back. And then Jennifer, my age and my weight, and never went back to that provider.
And the feelings, these bring some painful feelings and can be added to the stress of life that affects our health. We want to go to healthcare settings for help, not harm, don't we?
Christine also shared that I believe she has a new provider now who identifies as gay and is Black, and is a benefit from many other ways, and he has a great sense of humor. So she found someone who's been able to help her.
So we need to keep up that search whenever possible. Unfortunately, there are many places in the country where access to respectful care is in short supply. All right, I'm going to talk a little bit about racism and the history of racism because maternity care is negatively impacted by racism, misogyny, paternalism, etc. So let's focus on the history of racism. I think it's important to see how it developed so we can understand why it persists. Now, there was a world before racism, a time before being Black or from Africa was a stigma. Theories of white superiority were developed by Europeans to justify slavery and the slave trade beginning about 400 years ago. Doctors and others put together a pseudoscience of inferiority of Black people and lay the foundation for devaluation and exploitation of Black people. The pseudoscience still influences medical care, education, employment, housing, etc. Doctors have blamed race instead of racism for poor outcomes, sort of like blaming your uterus for your problems. They blame the patient often, and I've seen this during my course of my career. Most clinicians are not aware of the ways in which long-held stereotypes influence medicine historically and today. Experimentation on Black people went on late into the last century. Forced sterilization and mistreatment of people of color still goes on, as does discrimination, segregation, and criminalization of patients, such as calling Child Protective Services. About 1/3 of African Americans report discrimination in medical settings. And we could be here all day listing examples of racial injustice in the healthcare system. Contrary to popular belief, the civil rights movement did not cure the nation of white supremacist ideology, policies, and practices. That's why racism is a public health crisis. Decades of research shows that racism affects the health of Black people beginning in childhood. On top of that, discrimination adds to the allostatic load of the stress of growing up Black in America. The combination of racism and disrespect in healthcare are especially harmful and sometimes deadly. And I'll repeat that. The combination of racism and disrespect are especially harmful. The father of patient safety, Dr. Lucien Leap, sums it up this way. Disrespectful behavior threatens organizational culture and patient safety in multiple ways. Today, we are focused on dismissive treatment of patients and how it impairs communication and their engagement as partners in safe care. With the history of experimentation and ongoing disrespect and discrimination, it's no wonder Black folks are often reluctant to go to doctors or trust their recommendations. We will be listing solutions, but first we're going to review how disrespect and racism manifest in maternity care, and we're going to begin with the history of obstetrics. And you might recognize this picture of J. Marion Sims as he was about to experiment and perform surgery on Lucy, Betsy, or Anarcha. In the 1800s, doctors experimented on the enslaved and poor to develop their procedures. Then they put down midwives as dirty and uneducated and passed laws to limit or eliminate traditional midwifery. At the same time, they capitalized on women's fear of pain and convinced them that so-called care was better and safer in the hospital, and that they could give birth without pain. They profited from the medicalization of birth by introducing drugs and interventions which usurped birthing persons' control over their own bodies. We have seen the results in the rising number of C-sections and the worsening maternal mortality and morbidity in the United States, especially when compared with other wealthy nations. U.S. mothers die at 3 to 6 times the rate of the maternal deaths in Europe. And at the same time, we spend at least twice as much as those countries on maternity care. Worldwide, midwives support the majority of births. Midwives allow time for birth to happen naturally, so costly and risky interventions are far less frequent. Here, doctors deliver 90% of babies. And I say deliver, even though we know babies are not pizzas. 90% of the people who give birth are attended by doctors in the United States. Yet mothers here are at higher risk of dying than mothers in 53 other countries. And for Black mothers, the risk is 3 times higher than white mothers. This disparity is not just related to poverty or access to care, because Black women who are well educated and have insurance have 5 times the risk of maternal death than their white counterparts. And 80% of the maternal deaths in this country are preventable, according to the CDC. In the Giving Voice to Mothers study, over 2,000 people who gave birth in the US were surveyed. 1 in 6 reported mistreatment. Black women were twice as likely as white women in this study to report that a healthcare provider ignored them, refused requests for help, or failed to respond to a request for help in a timely manner. In addition, those who disagreed with providers were 8 times more likely to be mistreated. And many of you know mistreatment of any kind is known as obstetric violence. This term came about in the 1990s as the international community started to protest the abuses that were going on in labor and delivery units around the world. Obstetric violence is a common cause of traumatic birth experiences. It ranges from disrespect to coercion to physical assault, and it is perpetrated more often on people of color. Now, I have another question for you all. How many of you have experienced birth trauma or know of someone whose birth was traumatic? Up to 45% of birthing people describe a traumatic birth experience. Birth trauma is distress experienced by a mother during or after childbirth. While trauma can be physical, it is often emotional and psychological, and it can result in postpartum depression.
I see in the chat, yes, I know many.
Many.
Yes, I know someone who had a terrible birth experience and left the hospital and felt ignored by the staff. Yes, many. Yes, lots of my friends and family members.
I work with doulas in training, and I hear many stories of, and I can reflect back on my career, and I can see how the routine care is degrading and disrespectful. So this is something that I'm working on now, this problem, and that's why I'm giving this talk today.
Here's another comment here. At 32 years old with a master's degree, I was convinced to use Pitocin. Horrible experience, but blamed for not taking classes that were offered. I had birth trauma with my son as an old L&D nurse, saw many traumatic births.
And then we also had one by comment by Ariel. My client went through birthing trauma. It made me feel hopeless.
Yes, there's secondary trauma for the birth companions, the support persons, the doulas. There's secondary trauma, seeing what's happening to their clients or the person that their loved one. So that's why we have the Shades of Blue project, which has, I encourage folks to check out. They have groups, sessions for support for those who have been through birth trauma or experiencing postpartum depression. So, moving on, the preventable deaths of Black people, whether at the hands of police or in the care of doctors in the hospital, are the tip of an iceberg of racial oppression and harm experienced by Black people in the United States and other people of color. When it comes to maternity care, there is an iceberg of harm in the form of obstetric violence and birth trauma. And you all have just given witness to that. For every mother who dies, there are 100 who almost die. Interviews of women who almost died in New York City revealed that most experienced disrespect and dismissal or neglect of their complaints. And it's very common for vaginal examinations and procedures to be performed routinely without consent. To pressure them to comply with orders of medical staff, birthing people are coerced with threats of harm to themselves and their babies, threats of calling Child Protective Services and having their baby taken away. Vaginal procedures done under coercion and without consent amounts to rape culture. And there's no accountability, or there's little accountability in the healthcare system. So we're definitely going to be working on that. We have been working on that with the Earth app, etc., and other ways. But this is definitely a problem that needs to be worked on. When people complain about the care that they've received, they're often told, "You should be happy we gave you a healthy baby." I remember hearing this. Postpartum depression is a common result of birth trauma and obstetric violence. So we've got to develop the ways to, and increase the ways to protect ourselves. Everyone who's giving birth, a doula would help. Childbirth education for a partner along with the birthing person. These are ways that we can try to defend against obstetric violence. So, we have briefly delved into the problem of maternal harm for lack of respect for the humanity of birthing people, especially people of color. Now we can turn to solutions. We're going to list some of the ways that consumers of care can get respect. We have a human right to safety and respect in healthcare, and we can be more aware of those rights. We have a legal right to informed consent, and I think informed choice is a better way to call it. Bringing an advocate or a support person like a doula or having them on the phone is another way to get more personalized and respectful care. We can carry that Bill of Rights, make a copy, bring it with us to the hospital, have literature on about your health concern and refer to it during the visit with a provider. Stop the provider from functioning on autopilot. Doctors are on autopilot because they're pressed for time or they're suffering from fatigue or burnout. They're often under production pressure, and I've experienced this. Production pressure by their place where they work. So you're bringing attention to yourself as an individual can help get more respectful care. It's just saying something as simple as, "Hey doc, how are you doing today?" can snap them out of it. Get them to focus on you as an individual. We can check out the maternity and medical services in advance whenever possible. This is important during pregnancy and birth, and it's important when someone's ill or facing medical challenges. Find a place that you feel comfortable, where the staff are friendly and respectful. Ask the provider questions and see if they respond with the bedside manner that makes you feel comfortable. Check out the place in advance if possible. Do you see others who look like you? What do you see on the walls and in the magazine racks? Preparing for the visit helps. It helps you and your provider to address your concerns, helps you avoid errors, helps them to avoid errors and misdiagnoses. And you can partner with your provider. Form a team with your provider and your advocate. Your advocate can assist in making sure that all questions are answered and issues are addressed when you're not feeling well or if you're in pain. And that's an especially important time to have an advocate. There are, on our website, on the Black Coalition for Safe Motherhood's website, we have a glossary, and the first listing in the glossary is what is an advocate, how to be an advocate for someone else. When necessary, and I think this is important for most conditions, health conditions, pregnancy, become aware of some of the leaders in the field of the issue that you're dealing with, or the people in charge of that part of the hospital. Be ready to drop names. Asking for people by name or mentioning people by name helps get special requests answered and to get advantages that may make the healthcare experience better. For example, here's an example. If the staff on labor and delivery, someone on labor and delivery is talking about, oh, I think we're going to need to do a C-section. You don't see the need, and they don't give an adequate explanation, or whatever the situation, you can ask for the head of obstetrics. You can ask for the person in charge of labor and delivery and get a second opinion. Asking for them by name is a power move. Here's another question for you to give input into the chat. Are you reluctant or afraid to disagree with your doctor?
So also while you were talking, Tina put in there also to know the right to have language and interpretation assistance.
Yes, yes, yes. One doula recently told me about her client who was a Haitian Creole speaker and underwent a C-section without an interpreter. It was just horrible. And these stories are, it's almost traumatic just to hear the stories. Imagine if you're there. So there's a lot of harm happening because hospitals are not following those kind of basics rules.
We have a lot of yes and agreements to it, but also mentioning that it is not for them personally, but definitely for clients. Also, Christine shared she is perceived as difficult. I may not get treated worse. I try to be a good patient. That's an interesting one. The labeling.
Right, the labeling. It has come up multiple times in our workshops so that we routinely address, do you police yourself because you do not want to appear to be that angry black woman? It's heart-rending. It really is. And so that's why we need a mass movement on this issue.
Tina also has
Yes.
said, excuse me, that she is reluctant to disagree with her provider because when I am sick or in pain, there's an urgency and no other provider is available at that time. Yeah, that's. Mm.
I'm going to move on so that we have time for questions. There's a movement for respectful maternity care. It's been going on a long time, but it finally seems to be reaching the US. It's a worldwide movement started over 20 years ago at an international conference in Brazil to address obstetric violence. And it's care that emphasizes the rights of women and babies to evidence-based care with dignity. The midwifery model of care is a person-centered care. It supports the natural process of labor and birth. And visits with midwives are much longer than with a doctor. The JJ Way is an example of respectful, supportive care model, and they've measured their results, and they've shown they basically reduce many disparities that are seen between people of color and white people in this country. So, and Jenny Joseph now has a midwifery school, and she's been practicing in Orlando this way for 30 years. So, so we need more of that. What we're talking about when we say respectful care is care that respects and prioritizes patients' or clients' values, needs, and preferences. And everyone has a right to respectful care. And hospitals need to meet this standard if they want to be designated birthing friendly. So the White House blueprint for addressing the maternal health crisis has many different steps that they want hospitals to take, and if they don't take those steps, they won't get this birthing friendly designation. They must ensure, and I'm quoting from the White House blueprint, they must ensure that all women are listened to, respected, and provided the needed information and explanation during their pregnancy, delivery, and postpartum and feel empowered to be decision makers in their own care. And this just came out. There's finally recognition of the need for respectful care among the leadership at the American College of Obstetricians and Gynecologists. They have a new course called Explore Respectful Care with ACOG. It includes interviews with subject matter experts who are mostly Black obstetricians and historians like Dr. Karen A. Scott and Deidre Cooper Owens, and they discuss race and birth equity, the medicalization of birth and obstetrics, unethical experimentation on marginalized populations, and how these practices have shaped OBGYN care today. They also discuss respectful maternity care and how to put it into practice. Now, this is an optional 90-minute course, so we don't know, who's going to take it. There's the people who are older and in practice now will need to be replaced by the coming generation of OBGYNs so that we'll have doctors who have reflected on the abuses in the system and are seeking to correct them. Now, other elements of this new movement, and I'll just mention them briefly, are respectful care simulation training. There's more anti-racism training going on in states like New Jersey and in Maryland. I know of specific cases. Implicit bias education, that's usually too superficial for my taste to make a difference. There's even new payment models, in which doctors are paid based on improved outcomes. And of course, we have patient reviews like the Earth app. I implore everyone who is a doula, a birth companion, support person, or a birthing person of color to use the Earth app to find reviews and to leave reviews. And now, Press Ganey, which is a hospital-based reviews across the country, they are starting to get data based on reviews of hospital care by Black and brown people. So it's important to fill out those reviews in the hospital. Now, I'm going to go into what we do in our ACT workshops. ACT was designed by Black women for the Black community because of the unique challenges faced by Black birthing people and their supporters. Now, this list we have seen already, and now I'm going to talk about what we do and what we say in our ACT workshops. This is what ACT stands for: ask questions, claim your space, trust your body, tell your story, and I will describe what each of these mean. Ask questions until you understand the answers. It's not just ask questions, it's ask questions until you understand the answers. Claim your space, both physical and mental, that's your bodily autonomy and your dignity and self-determination. Trust your body. Have confidence in your body. That empowers your labor. And trust your body. In other words, if you have symptoms that are concerning, make sure you don't dismiss them, but get attention for them. Tell your story. That means tell your provider what you're feeling. Tell them about your symptoms. Tell them if you've been disrespected or you feel dismissed or not heard. Tell your story can be healing if you've been through a traumatic birth experience. And in our ACT workshops, Black and brown mothers tell their story and help others to learn from their experiences. As I said, the ACT curriculum was developed by Black birth workers, obstetricians, nurses, doulas, midwives, because the experience of racism presents particular challenges for Black birthing families and the supporters. In our workshops, we emphasize that everyone has the human right to safe, respectful, quality care. Everyone has the right to ask questions and get the information they need to make informed decisions about their health, their pregnancy, and their birth. And everyone has a legal right to informed consent before agreeing to or refusing, I emphasize that, any test, procedure, or treatment. And pregnancy does not limit rights to dignity and autonomy. And the American College of OBGYN has a statement on the right of refusal also. Informed consent must be based on the best medical evidence, not just the opinion or the preference of the provider. It really should be called informed choice. And it's a legal and ethical obligation of providers to explain the nature of the recommendations that they're making. What is the person going to go through if they accept this recommendation? What are the risks and benefits? And all this must be explained in terms that the person can understand. And all questions must be answered. The alternatives must be described, including doing nothing. Someone can say, "What if I don't do anything, doc? What might possibly happen if I don't do what you recommend?" That has to be explained as well. And it's a conversation. It's not a sign here on the bottom dotted line consent form. It's a conversation, it's a process, and it is neglected or skipped too often. And that is traumatic for the person who undergoes a procedure without being informed. And we have take-home messages in our ACT workshops, which have been mostly virtual and via Zoom. And so we say to the participants that you have right to your space, your personal dignity and bodily autonomy. It's important to be informed and involved and take charge of your care. Get the best services available. It really makes a difference where someone gives birth. Bring an advocate with you, and if possible, be an advocate for someone else. We also emphasize in our ACT workshops, and I haven't dwelled on it much here, but we emphasize that being supported, well supported in a holistic way, is healing from the impacts on the body of growing up Black in America. So we encourage birthing people to form a team, gather a team, a support team around them. I have another question for you all. Have you ever had to advocate for yourself? And how did it go? Have you advocated for yourself, and how did it go? Have you ever found yourself facing illness or medical adversity and then been dismissed or ignored when you were seeking help? And you can put your answers in the chat. Yeah.
I'm sorry, people are asking in healthcare. Yes, this is around a healthcare.
Yes, in healthcare, have you, I mean, people are more challenged often to advocate for themselves in healthcare, where it's more important than, say, if you're at a hairdresser's and you want your hair to be done a certain way, you're going to say what you want. We need to start saying what we want when we go to a healthcare provider. Putting oneself in a patient's place or client's place is not easy if you're a busy medical professional, unless you've been a patient and experienced misdiagnosis and mistreatment yourself. So the providers, if they haven't been a patient, they often will not be able to relate. But we need to, say, would you want this for if this was you?
There's a couple in the chat now. It says, yes, I couldn't see my doctor. I couldn't get my doctor to see me in person, is one. Another is, yes, I asked for glasses when I turned 40, and the doctor didn't want to give me the glasses because my eyes weren't that bad enough. I could tell a difference in driving. I'm not going to wait. And then the next comment says, sometimes you have to amp up your symptoms. You kind of have to lie. That's sad. but
Wow.
true, but true.
Yeah. In our ACT workshops, we do interactive role play. Facilitators ask participants, what do you say in a medical setting when the provider's answers are not clear or when they're rushing you? What can you say if you were dismissed or you feel you weren't heard? Suppose you're not getting the care that you know you need. What can you do about that? What if there's a disagreement about the care? Suppose you were like in the situation of Serena Williams and you were, as she was, experiencing a complication, and or you're just really concerned and the hospital staff, the nurse or the doctor are not listening. These are some of the challenging situations that we consider as a group in our ACT workshops. In some of our workshops, we do consider Serena Williams' story, and it's important for medical professionals to learn from her story as well. She's, as you know, a wealthy tennis star. She had a baby, and she had, and because of her history of a pulmonary embolism before, she knew what that feels like. A clot in the lung causes some serious symptoms, and she had experienced it before. So after she had her baby, she was experiencing those symptoms again. She was high risk for that, so they should have listened to her. She told them what she needed. Instead, they sent her for an unnecessary test while she should have been receiving treatment that she asked for. She knew something was wrong. And I have to say, I don't understand how doctors dare tell someone what they are feeling. How dare they dismiss the symptoms without an explanation? And it happens so often. They just dismiss the symptoms as, oh, they're minor and it's nothing serious is going to happen. And we know that serious things have happened. So what Black women are saying is, believe us, listen to us. And the same is true of experts in the field. Listen to Black women experts who know what's going on in maternity care. The people who are in charge of most hospitals are not listening to Black women. And that's why we're not getting the solutions that we need implemented. So people who use ACT in practice to get safe, respectful care will hopefully find providers, and this is addressed to providers at this point. I don't know if we have any in this group, but for providers, we want providers to respond positively to the questions and concerns of those who are advocating for themselves, who are using ACT practice. Providers should be facilitating communication with their patients and their patient advocates by leaving space for dialogue, centering their values, and focusing on the person as a whole. In so doing, trust is built, stress is reduced, and care is improved. Rushing through patient encounters is stressful and harmful for both patients and providers. Unfortunately, providers are under time pressure because of cost constraints and tight profit margins. This is one reason why it would be helpful if we had more midwives giving that person-centered care, which Black midwives especially are adept at. The evidence is overwhelming that the care of midwives improves outcomes, so does doula support, and most people can give birth safely outside the hospital. I mourn the fact that this is the only country in the world where people don't know that everyone deserves a midwife. Some people need an obstetrician too, but it's a false notion that doctors are more qualified than midwives to deliver babies. Midwives are experts in supporting birth. In every setting, midwife-led maternity care results in reduced infant and maternal mortality. Again, in every setting, midwife-led maternity care results in reduced infant and maternal mortality and morbidity. Fewer medical interventions, decreased costs, increased savings, and improved client satisfaction. And this is from the Midwives Alliance of North America. I also refer you to the websites of the National Black Midwives Alliance and the American College of Nurse Midwives. So what does this lead us to? Where does this leave us? What do stories like Serena's and so many others mean for medicine? And I say for medicine because this problem isn't limited to obstetrics. Results of a study examining 1.8 million hospital births in the state of Florida indicate that newborn physician racial concordance is associated with a significant improvement in mortality for Black infants. But if we can't ensure that everyone gets to see a provider with a shared background and life experiences, what else can be done? For the time being, at the very least, healthcare professionals can take a deep breath and be mindful of the humanity of the person in front of them. Consider that they may need trauma-informed care, that they may need person-centered care for healing and optimal health. There must be a pushback by providers of care on the system in which they work, to have space and support to practice in a way that lives up to their oath to heal and to do no harm. Making a conscious effort to give respectful care and mitigate bias requires time and energy, which the medical industry pressures often do not allow. So we need a mass movement on a personal, institutional, and political level for respectful care. Major legislation, which many of you are probably aware of, the Momnibus, is sitting in Congress. It's been there for a couple of years now. So we need a mass movement. Please contact your representative and the senators. This is a huge bill, and it will have impact over this next several years if we can get this passed. We're in a situation that's not unlike the civil rights movement. And as Dr. Martin Luther King said over 50 years ago, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. In case you're not familiar with it, I will just share this tool, which is useful not just for New Yorkers. The New York City Standards for Respectful Care at Birth is a detailed pamphlet reviewing all the ways that a person can get person-centered care and make informed choices during pregnancy, birth, and postpartum. And they close with this: birth justice exists when everyone has the freedom and support to make decisions about pregnancy, childbirth, and postpartum with dignity. This is the Birth Justice Bill of Rights from the National Black Midwives Alliance and the Southern Birth Justice Network. This is useful for Black birthing people, and it's a good thing for providers who care for Black and brown birthing people to be familiar with as well. Here are the works that I cited, and I thank you for your attention. And I'm happy to answer questions now, and you can email me if you want the references. I can send the references to you. Thank you, everyone.
Thank you, Dr. Farrington. This was just even more information than I have received, even in the ACT training. I learned something new each time. I didn't share that I met Dr. Farrington at a conference in Washington, D.C. this fall. And even when we were just chatting, she shared the work she was doing, and I was blown away. And I was like, oh, we need you, we need you. And so this is the first of many, we hope, in a relationship to share this valuable information. And also, I want to read what's in the chat. There were some comments. Christine was asking, is it because midwives are women? Do you think that's one of the reasons why there's this value issue or listening?
Well, if the obstetricians and doctors have always wanted to see how they could take over the business and make it a business, take over birthing and make it a business. And they saw in the 1920s, 1930s, that if they could get women to come to the hospital, they could charge them. And so, yes, it's paternalism, capitalism, yes. And doctors have always been having this sense of superiority. And that's why I appreciated the work of Dr. Lucienne Leap exposing this problem. When I decided to retire, I told a colleague, and he said, "Won't you miss the prestige? You know, this is the way doctors think." And yes, it has always been men controlling women's bodies. So yes, and I'll stop talking because you know I can go on, Nicole.
Also, Mother Hazel is saying this information, excuse me, needs to be published so that the community can see and hear this information. And then she went on to also, Linda went also on to say that sexism, paternalism, and money is also a factor. And then Christine said, like over 50% of births, neither of my kids were planned for. Much of this takes planning, so it does not fall on providers. No. So it's
Is
kind
that
of
a question? Is that a question?
it's a question. It seems like it's a question and a statement. I think, you know what? I'm going to click here. Our group isn't so big. So let me just see, because I don't want to interpret what you're saying. So I'm going to try to find you, Christine, so that you can share your own comment. Sometimes it's hard to see when you scroll up. There you go.
Oh, what I mean to say is a lot of the ways to advocate for yourself or someone takes a lot of planning, and many births are unplanned. So it really does speak, it's the responsibility more of the health providers, don't you think?
It's a responsibility. It's a health literacy is a two-way street. Communication is a
Yeah.
two-way street, and whether it's planned or not, there should be respect on both sides, not just fear on one side and power differential between providers and birthing people. It doesn't matter whether your birth is planned or not. Yeah, and it does help to once you are pregnant to get to have that childbirth education so that you can be more assertive on behalf of yourself. I agree with that. It definitely helps to have more knowledge about your whatever condition you're going to the healthcare system for, and that way you can take charge of your care. Yes.
Thank you.
And then also Linda said this started in the 1900s with the first OB journal published, denigrated midwives.
Yes, they definitely, it had to do with misogyny and racism because many of most of the people giving birth in the South especially were with traditional African American midwives. So fortunately, we have not lost that tradition, and people like Mama Shafia Monroe and others are keeping that alive. And we have our Jenny Joseph's Common Sense Childbirth Midwifery School. But we need the community to be aware that midwives save lives, and that way we'll start to push for more community-based care and support each other.
Wonderful. I think that's our last question for our session. In respect of time, I want to again thank Dr. Farrington and also share that Wayside is having a conference in May. The save the dates are May 10th and 11th. And just before our call today, I wanted to make sure that ACT workshop presentation could be a part of that mini conference. They will be half days. And those of you who are subscribed to Wayside's page in these sessions, you will get to hear more information. But again, it is valuable information. I can't wait for the continued work that Dr. Farrington and her team and organization will be working on, because it's extremely valuable. So I'd like to thank everyone for attending. I see lots of thank yous in the chat. And I hope that you'll even review the video recording that is on, or share it with friends to take a look, and hope they'll be attending the conference in May. Thank you, everyone. Thank you for your patience, and have a great afternoon.
Bye-bye.